So good morning, everybody. Welcome to today's Security Health Plan Academy presentation on hypertension and your health. Joining us are Security Health Plan Chronic Manager Karen Taylor and Security Health Plan Clinical Pharmacy Specialist Amanda Sigler. Today's topic is going to chat about preventing and treating hypertension or high blood pressure. So with that, Karen, we'll hand the baton to you.
Thank you. All right. I think we'll start by looking at what is blood pressure. What are we really measuring? Blood pressure refers to the amount of pressure the blood exerts on the walls of the blood vessels. When you have your blood pressure checked, they're measuring that pressure, the pressure that the blood is putting on the walls of the arteries. The pressure is generated by the contraction of the heart muscle. When the left ventricle contracts, it pushes the blood into the aorta with force. And that force is that pressure that we're measuring in the arteries. The top number, when they take a blood pressure, that top number is the highest the pressure gets. And that occurs when the heart beats and the blood is just being pumped out. The bottom number, normally less than 80, is the lowest pressure, which occurs when the heart is resting and filling with blood. So the heart beats, generates some pressure, forcing the blood into the arteries. Hypertension then, or high blood pressure, is a persistent elevation of the blood pressure, the top number, the bottom number, or both. Elevated blood pressure is a serious problem for several reasons. First of all, that high pressure in the arteries causes the heart to have to work harder. If the pressure in the arteries is high, the heart has to create higher than normal pressure in order to get that blood out of the ventricle and into the artery. Creating that higher pressure makes the ventricle work harder. The heart is a muscle, and like other muscles, when it's forced to work harder for a prolonged period of time, it gets bigger. This is known as hypertrophy. In the case of hypertension, then it would be considered an enlarged heart. And at least when it comes to the heart, hypertrophy is not a good thing. Larger, thicker walled ventricles, that hypertrophied ventricle shown here, holds less blood, can't pump as effectively, and can eventually fail. The term heart failure is used to describe a heart that's no longer capable of pumping the amount of blood needed by the body. Another reason hypertension is a problem is that when blood vessel walls are constantly faced with high pressures, they have to toughen up so they can withstand that high pressure. To toughen up, the vessel walls become less elastic and thicker. That narrows the space inside the vessel. These changes further increase the pressure inside those vessels and make the problem worse. The narrow blood vessels also decrease the amount of blood flow that can go to the body organs and decreases circulation. Third, high pressure in the blood vessels damages the lining of those vessels, and that allows lipids, those nasty LDLs, to enter the vessel wall and form plaque, known as atherosclerosis. The atherosclerotic plaque further narrows the blood vessels, raising the blood pressure and decreasing circulation. Worst part of it is, if allowed to persist, those changes are permanent. You are stuck with them. Because these changes in the heart and in the blood vessel are permanent, it's really important that high blood pressure is diagnosed early and treatment started. And once diagnosed, it's essential that medications are taken as prescribed, even when feeling good, to prevent or minimize the damage and the consequences of high blood pressure. Those problems that high blood pressure can cause include heart failure, a heart attack, stroke, circulation problems, kidney failure, and a loss of vision. So how do we diagnose hypertension? Well, first of all, one high reading or even an occasional high reading doesn't make for a diagnosis. Hypertension is a persistent elevation in blood pressure, meaning it's elevated more often than it's not. The best way to know if someone's blood pressure is persistently elevated is to check it at different times during the day for several days. If you're getting high readings, keep a log of those blood pressures for at least a week or more, and then share it with your healthcare provider. If you don't do that, if you just go see your healthcare provider, they're going to say, well, go home and keep a log for a week and come back. So might as well just do it to begin with. Get that log down. The log will be very helpful for your provider to determine whether you really have hypertension. Check your blood pressure on both arms on occasion to see if the results are the same. A few numbers different doesn't matter, but if there's significant differences, you'd want to discuss with your healthcare provider. When measuring your blood pressure, the person should be seated comfortably for several minutes before checking. The legs should not be crossed. And you need to make sure that the proper size cuff for the upper arm is used. Not too big, not too small, that Goldilocks, just right size. Not doing all these things can give you inaccurate readings, high when it's normal or normal when it's high, and getting inaccurate readings is totally useless. A clinic nurse can help you identify if you need a regular or extra large cuff. If the blood pressure reading you get is elevated, check it again a few minutes later and record that few minutes later result. If your blood pressure is less than 120/80, keep up the good work. Check it again at least once a year. If your blood pressure is a little bit elevated, the top number between 120 and 140, and or the bottom number between 80 and 90, see your healthcare provider. Double down on your healthy lifestyle changes, which I'll talk about in just a second, and recheck it more frequently. If you have other risk factors for heart disease or stroke, your provider might want to start you on medication at this early point so that you don't develop any of those permanent changes in the heart or blood vessels. If your blood pressure is persistently above 140/90, lifestyle changes, medications, one or maybe two, and more frequent monitoring are indicated. Okay, so what are those lifestyle modifications? Well, we use them to prevent hypertension. We use it in the early treatment and in the ongoing management of high blood pressure. And once you get your blood pressure under control with medications, it doesn't mean you can stop doing all of these lifestyle changes either. These changes include eating a low salt, heart healthy diet, avoiding excessive alcohol, and exercising regularly. Those things will all help in achieving and maintaining that healthy weight, which is good, and in coping with stress. Altogether, they will lower your blood pressure. A win-win all the way around. Smoking isn't really good for anything, so you can't be surprised that it makes hypertension worse too. What is a heart healthy diet? Well, they'll often recommend the DASH diet if you have high blood pressure. DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet involves eating lean proteins, fish, chicken, eggs, legumes, lots of whole grains, fruits and vegetables, using low-fat dairy products, and limiting fats and sweets. Kind of like what you're eating right now, right? And if all the healthy lifestyle changes can't get your blood pressure where it should be, then drugs are probably needed. And I'll turn things over to Amanda, and she'll talk about medications for hypertension. Here you go, Amanda.
Thanks, Karen. So today we'll be talking briefly about a few different types of blood pressure medications, and then the main focus will be on why it's important to keep taking your blood pressure medicines. So this first slide here, I just wanted to highlight a few of the different blood pressure medications that are available and some common side effects of each. So the first one I have listed on there are a class of meds called the ACE inhibitors or the ARBs. So this would be anything for example, like lisinopril or losartan. So commonly we do hear that some patients do get a dry cough with drugs like lisinopril. So sometimes their provider switches them over to losartan, which does not always have that one does not have a dry cough. The next medications available are beta blockers. And a common thing that we hear is sometimes people do have some dizziness with standing on these. So if that's happening, feel free to talk to your provider about it. They might have some good suggestions for you. And also, might be able to adjust your dose because these do affect everybody differently. The next class of drugs are the diuretics, so commonly known as water pills. So meds like furosemide, and these, it's really best to take them in the morning. They do increase the trips that you have to the bathroom. So usually it's recommended to take them in the morning versus the evening, so you're not waking up during the night. And then the last class of meds that I have highlighted are the calcium channel blockers. So meds like amlodipine, these can sometimes cause some ankle and leg swelling. So again, if that's burdensome, make sure to talk with your doctor. And I guess the key point that I really do want to emphasize is that, everybody's different. They do get side effects from these medications, but if you are having a side effect from one of your blood pressure medications, please make sure to talk to your doctor or pharmacist about it. There's so many medications available for treating high blood pressure that there will be options for you in either a different drug class or maybe just adjusting the regimen that you're currently on. So never make changes without talking to your doctor. These meds are really important to stay on to help keep your heart and your body healthy. So this next slide, so I just want to talk a little bit about medication adherence and what does that mean? So that means taking your medications as prescribed and taking them on time. So making sure you're taking them the right way as your doctor intended. So high blood pressure is one of those things that you don't always feel that your medications are working. It's more of, something that takes place slowly over time. So you might say, well, I'm on a few blood pressure medications, but I don't think they're working. I can't tell. So one way to tell is to check your blood pressure and see where your reading is at. And if you're taking your meds as prescribed, you will see good results with your readings. And missing blood pressure medications and maybe some other medications on your regimen, it won't be good. It can increase your risk of potential heart problems like a heart attack or a stroke. So that's why it's really important to stick with your routine and just reach out to your doctor or pharmacist if you do have any questions. So this slide, I just wanted to put a few tips on here of ways to help remember to take your medicines. So medication or pill boxes is a great way to stay organized. And they even have pill boxes with multiple compartments so that you can get your morning, afternoon, and evening doses in. So that's a really good tool if you're really busy and it's just easy to stay organized. You can also set reminders on your phone or calendar, place sticky notes if you're a sticky note person, that can sometimes be helpful, or even just storing your medications in a place that's safe that you'll remember where they're at. So that's important, usually to have them stored in a good place where they're not absorbing extra humidity. Sometimes people say they store them in the bathroom in their medicine cabinet, and that's not always the best idea because the humidity from the shower and the water running can break down your medications. So just keep in mind storage, and then make sure that wherever they're stored, they're kept safe from any kids that might be around or pets that you have. And then another really good way is just to have the pharmacy fill 90-day supplies if you're able to. That will just decrease the amount of times that you're having to run to pick up medications and remember to get them filled. So if cost is a problem with any of your medications and you're a Security Health Plan member, please feel free to give us a call. We've got multiple pharmacists and technicians on staff, and we're happy to help research less expensive alternatives for you, or look into if there might be any copay assistance available. So feel free to utilize us as a resource, and we're more than happy to look into any cost savings questions that you might have. So a question that I will commonly get is what do I do if I miss a dose of medication? So usually if you miss a dose, you could take it as soon as you remember to take it, unless it's very close to the next time that you would take it again. Or if taking it too late in the day would cause problems for you, like I mentioned, the water pill, not recommended to take at night, then you might want to wait till the morning to take the next dose. And if you do have any questions on that, your doctor or your pharmacist will be able to help come up with a plan for you. So another element that I just wanted to highlight for our Security Health Plan members, we do offer a service where you can get your medications reviewed with a pharmacist. And this is really for your benefit. So we're able to answer any questions that you have. And we also really do a thorough review. We look at any prescription medications that you're taking, or any over the counters or supplements. And we really do a deep dive. You know, we'll check your lab work to make sure that everything looks okay. We'll highlight if you're due for any preventative screenings or vaccines. And the great thing about this service is that it does not cost you anything. So this is covered as part of your pharmacy benefits. And we do a lot of times reach out to members individually if they qualify for this service. However, you know, if we do not reach out, you can always feel free to give us a call to make an appointment. And our appointment number here is listed on the slide. And so feel free to call and leave a message if we don't answer, and be happy to get back to you and set something up. And really, you know, we're able to help answer any questions that you might have on your medications. And our goal is really just to give you a great understanding of what you're taking every day. This slide, I just have a few ways to help with blood pressure. So, you know, if you think about your daily coffee routine or caffeine routine, just remember that caffeine does cause your blood pressure to be elevated. So try to keep in mind how much caffeine you're drinking a day, as that can have an impact on blood pressure. Some other things that can impact blood pressure are over-the-counter medications. So right now is allergy season. A lot of people running to the pharmacy to pick up decongestants like Sudafed. Just know that these do elevate blood pressure. And if you do have high blood pressure, it would be recommended to find something that does not have the Sudafed in there. So something like a nasal spray would be more appropriate. Feel free to reach out to your pharmacist, you know, if you do need help finding something that's safe for you. Another common class of meds that can elevate blood pressure are meds like ibuprofen and naproxen. And so those do have an impact. If you're able to take something like Tylenol, that would not elevate your blood pressure. So there's always alternatives out there. So just, you know, feel free to consult somebody, and they can help get you on the safe over the counters. Just because they're, you know, over the counter doesn't always mean that everything's safe. So that's another thing we do always talk about during the medication reviews that we offer at Security Health. And I also wanted to touch on at Security Health Plan here, we do offer a benefit called the over-the-counter benefit. So this is offered with a lot of our plans. And so what this benefit means is that each quarter you're allotted an amount to spend on over-the-counter medications on our online catalog. And as part of that offering, we do have blood pressure cuffs and monitoring devices in there. So this is a great way to get a monitor without having an out-of-the-pocket expense. So if you have any questions on if you are eligible for this benefit, you can feel free to reach out to our customer service team. This is number on here is for ordering the over-the-counter products, or you can make an order online through your My Security Health Plan account. And then I'm going to turn it back here to Karen.
Security Health Plan also has care managers who can help members with hypertension or other health conditions. We can help you to learn more about high blood pressure, understand the DASH diet, and how to implement other healthy lifestyle practices. Find ways to remember to take your medications, overcome those obstacles to obtaining your medications, understand your insurance benefits, and just about anything to help you get and stay healthy. Just call one of the numbers on the screen there and tell them you'd like to talk with the care manager, and they will connect you with us. And does anyone have any questions for Amanda or me?
Hey, Karen, this is Ashley. I did get a few questions submitted before today's webinar, so I'm going to ask those. And then if anybody in the audience has a question, feel free to submit using the chat feature, which is located towards the bottom of your screen. But I will ask the ones that were submitted prior while we wait. So the first one is, if I have hypertension, does that mean that my children, grandchildren will have it as well?
Good question. High blood pressure does run in families, so there are some genes that might contribute to it. However, family members also tend to share behaviors, lifestyles, and environments that can also contribute to the risk of hypertension. So yes, but it isn't a huge direct relationship. The other important thing to know is that your risk for high blood pressure does increase the older you get, and certain races are at higher risk. Black people are more likely to develop hypertension, and they also tend to develop it at an earlier age and higher levels than other races. So if your parents and everybody else in your family has high blood pressure, you stand a pretty good chance. Both my parents do, and my brother does, and I do, but my sister doesn't. So go figure.
Another question, it was, does your blood pressure vary depending on the time of the day?
Yeah, it does. And part of it's hormonally related. Generally speaking, it starts to rise just before you wake up. It peaks in the middle of the day and starts to drop in the late afternoon, and its lowest during sleep. If you have hypertension, those readings will all probably be higher. So once you kind of get an idea for what your blood pressure is running, as I said originally, you should probably check it several times during the day. But then once you kind of get to where it's a good point and you know that that's what it is, and whether that's the one that you're working off of, then try and check it around that same time every time you check it, so that you don't have a lot of other things interfering with the reading that you're getting.
Great. Another person submitted a question. They said, I have sleep apnea. Does this put me at risk for hypertension?
I can take this one.
Okay.
So they have found a correlation between sleep apnea and high blood pressure. So the important thing would be, if you do have sleep apnea, is to make sure that you're going in for your yearly checkups with your doctor and getting your blood pressure checks when you're in the clinic. And then it also wouldn't be a bad idea to have a monitor for home monitoring, so you can kind of check your baselines throughout the year.
Yeah, and surprisingly, and I didn't know this, but I recently was reading that relationship between sleep apnea and high blood pressure goes in both ways. If you have sleep apnea, you're at higher risk for developing hypertension. And if you have hypertension, you're at higher risk for developing obstructive sleep apnea. So with either of those conditions, you should be seeing your provider regularly so that you can get them both taken care of and monitored.
Perfect. Question from our audience today. I started a new blood pressure medication. My blood pressure this morning was 105/68. How low is it okay for it to go?
Amanda, did you want to answer?
So, I'll just add that it is common to see a decrease in your blood pressure, especially right after you start a medication. So I would say, a reading of 105/68, that's not concerning unless you are feeling some of the symptoms of high blood pressure, or of low blood pressure. So if you're feeling some dizziness, or if you are trying to get up from a chair or out of bed and, you're really having some balance problems, then I would alert your doctor. Otherwise, just keep an eye on your readings throughout the day. Like we said, your blood pressure readings can fluctuate. So you might be surprised too at your lunch and evening readings versus your morning readings. But just keep an eye on those readings and make sure to check in at your follow-up appointment.
And I'll add as a nurse that most of the time we get concerned if that top number is less than 90. Now, some people can go along just fine with numbers in the upper 80s, but generally speaking, you want the top number to be over 90. And there isn't really a low on the bottom that we get overly concerned about. So symptoms, and even if you're asymptomatic, if it's getting down under 90, probably let somebody know.
Speaking of readings, and at-home readings, another question, how reliable are automated digital blood pressure measurement devices? This person ask, should I bring mine in to get checked or calibrated for accuracy?
I would always recommend to take the blood pressure monitor in for calibration just to compare it to the office readings. And that way you can be sure that your cuff fits appropriately, and you can kind of compare the reading that you get on that to the office reading. Usually there is some fluctuation between your home meter and the office meter. So I always recommend that. It doesn't cost anything to get it calibrated usually, and the nurse then can also check your fit and make sure that it's fitting your arm correctly.
And if it's just a little bit different, nobody's going to care. If it's widely different, if you're getting 10 or 20 point different readings, then you're probably going to want to use a different monitor.
And can we remind our audience what are some things to remember when they get their blood pressure checked at the doctor's office?
One of the things I wanted to point out, and I didn't in talking earlier, is there is something known as white coat hypertension. So when you do go to the doctor's office, you should do all the things, make sure you're sitting, don't just run into the office, sit down and let them check your blood pressure. You should be seated, relax a few minutes before they check it. Think calm thoughts, sit without your legs crossed. Certainly not at the knee. Crossing at the ankle isn't a big deal. Make sure they use the right cuff. I've had patients go into the clinic and they have a normal size arm, and the aide or medical assistant will grab the extra large cuff. Well, if they're not using the right cuff, say something. Make sure that the right cuff is being used, or ask about that. Bury your arm. You're going to get a more accurate reading without a sleeve in place. If you have a real thin shirt on, it's probably not going to make a big difference. But if you've got a bulky sweatshirt or sweater on, and they're trying to take it over the sweatshirt, that's not going to work. And take your arm out of your sleeve and let them get an accurate reading. So, and so if your blood pressure is elevated at the clinic or at the hospital or something, it's usually a good idea to then get them, if you don't have one already, get a monitor and start checking it at home, because some people, their blood pressure is only elevated when they're in the presence of a healthcare provider. They might not feel like they're stressed out and it's bugging them, but their body might be a little stressed, and that can make it higher in those situations. And you wouldn't want to treat high blood pressure if it's only high in the doctor's office.
And I'll just add, sometimes, you know, when you first arrive to the doctor's office, the medical assistant, you know, they're trying, you know, they're a little bit rushed, and they might try to take your blood pressure right away after you sit down, when you get into the exam room. And I always try to see if they can let me sit for a few minutes, decompress, because usually, you know, you're kind of rushed getting into the clinic and getting back there. So your blood pressure will be high just from exercising or the walking to get in the room. So that's something else that I recommend, just taking a few minutes just to sit quietly, so that your blood pressure can go back to baseline.
And if you question the reading that they get, ask. I remember I took my daughter to the doctor once, and they checked her blood pressure and they gave me like 120/80. And I knew it wasn't that. And so I didn't say anything to the assistant, but when the provider came into the office, he said, "Oh, your blood pressure is good, 120/80. I said, "You know, I don't think she checked it right. Could you please recheck it?" And they did, and it was not 120/80. So if you're not confident that the assistant got the right accurate reading, ask the provider to double check.
Great advice. Well, Karen and Amanda, thank you so much for joining us today. If anyone in the audience has additional questions, please feel free to send us an email. I think we will have a way that you can submit as well via our follow-up communication, which is scheduled, I think, for later this month. That'll include the recording and a copy of the slide deck. With that, I think we can go ahead and close. Thank you, everybody. Be well.
Thank you.